The Code of Ethics of Nurses in the Philippines Part 1. The Code of Ethics for Nurses in the Philippines is governed by the Philippine Nurses Association, PNA, and the Professional Regulation Commission, PRC. The Code of Ethics outlines the principles and standards that nurses in the Philippines are expected to adhere to in their professional practice. Here are the key components of the Code of Ethics for Nurses in the Philippines. 1. Commitment to service. Nurses are expected to provide compassionate and competent care to individuals, families, and communities regardless of race, religion, socioeconomic status, or cultural background. 2. Professional competence. Nurses must continually strive to enhance their knowledge, skills, and competencies through education, training, and professional development activities. They are responsible for maintaining a high standard of practice and delivering safe and effective care. 3. Ethical practice. Nurses must uphold ethical principles such as integrity, honesty, and accountability in all aspects of their practice. 4. Legal responsibility. Nurses are required to practice within the scope of their license and adhere to relevant laws, regulations, and professional standards. 5. Collaborative relationships. Nurses should foster collaborative relationships with patients, families, colleagues, and other members of the healthcare team. 6. Cultural sensitivity. Nurses should be culturally sensitive and respectful of diverse beliefs, values, and practices. 7. Continuous learning and research. Nurses are encouraged to engage in lifelong learning and participate in research activities to advance nursing knowledge and improve patient outcomes. 8. Professional conduct. Nurses are expected to conduct themselves in a professional manner at all times, both in their personal and professional lives. 9. Advocacy. Nurses have a responsibility to advocate for the rights, health, and well-being of their patients as well as for social justice and healthcare equity. 10. Environmental responsibility. Nurses should promote environmental sustainability and advocate for practices that minimize the environmental impact of healthcare delivery. It's essential for nurses in the Philippines to familiarize themselves with the Code of Ethics and integrate its principles into their daily practice to ensure the provision of high-quality and ethical care to their patients.